So I'll call Itai Fogel. Itai is a medical student doing his thesis in Shaare Tzedek, and would like to hear his experience about brachial plexus injuries.
Yeah, the study was done with Dr. Lebel and Dr. Sela in Shaare Tzedek Medical Center. Brachial plexus birth palsy, incidence, predictors, and natural course during the first year of life. The incidence of brachial plexus palsy is 0.15% of live birth in the US. Most of the cases are transient with spontaneous recovery, but long-term palsy may occur, as in the case of the last Kaiser of Prussia, Wilhelm II. The permanent recovery rates vary among studies. There are several known risk factors associated with the injury, such as shoulder dystocia, macrosomia, and assisted delivery. There is an overlap with the injury diagnosis and clavicle fracture because they have similarly presenting symptoms. Recent studies show controversy regarding the etiology and the management. There are some open questions regarding brachial plexus birth palsy. In some of the cases, there is no shoulder dystocia or delivery interventions. Additionally, the injury can occur after cesarean sections. So what contributes to brachial plexus apart of traumatic delivery? What is the role of early rehab? There are also controversy regarding the timing of the orthopedic intervention and the prognosis of the injury. The purpose of our study was to determine the incidence of brachial plexus palsy in one tertiary center in a large cohort of newborns. There are approximately 17,000 births per year in Shaare Tzedek Medical Center. In the study, we look for predictive factors for severe injury, which we defined as an incomplete recovery within 3 months. Another purpose of the study was to evaluate the recommendation for management in the newborn discharge papers. After the approval of the ethical review board, we detected all the newborns that were discharged from the hospital between the years 2011 till 2015 with the diagnosis of the injury to brachial plexus due to birth trauma according to ICD-9. Peripartum data and known risk factors were collected, and telephone interview consists of uniform questionnaire were used for all parents. After trying to reach the children's parents several times, 69% of parents were contacted, and eventually 66 agreed to participate in the study. Among 76,000 live births that took place in Shaare Tzedek during the time of the research, 98 were diagnosed with the injury according to the discharge papers, an incidence of 1.3 per 1,000 live births. 4 of them were born in cesarean section, 3 of which were elective C-sections. So who is in charge of the follow-up? And when does the follow-up need to be performed? Here we can see the variety of recommendation in discharge, not quite clear, but showing that children left the hospital with different instructions, referral to HMO, to neurologists, orthopedists, or without any recommendation or time and place. It is emphasizing the lack of consensus, which is currently in practice. After comparing between the two groups of severity with known risk factors, we can see that shoulder dystocia is strongly related with severe injury, and right-sided palsy is more frequent in severe injury than in mild. Although it's not statistically significant, suspected fracture may be correlated with better prognosis and fast recovery. When children are diagnosed with clavicle fracture and also recover quickly, it creates an uncertainty regarding the diagnosis, which was the case in 17% of the children included in our study. Permanent injury is seen in 18 to 50% of patients according to previous studies. As you can see from this pie chart, 77% of infants had a complete recovery within 3 months. 97% recover completely at 1 year of age. Just 2 infants had a permanent injury. The limitation of our study was the fact that the study was retrospective. Part of the study was based on telephone interview, and about 30% of the children parents could not be reached. Even though we had a good response to telephone questionnaire, and there were no significant difference between the group that replied to the interview to those that could not be found. Our main biases were recollection bias due to long period of the study and the limited ability of the parents to describe their children's medical condition. To conclude, recovery rate was 97% in 12 months, much lower than previously reported. Shoulder dystocia and right-sided palsy can be predictive factors for more severe injury. Clavicle fracture may cause pseudopalsy and might be a confounding factor. Caesarean section reduces, but does not completely prevent the injury. And clear guidelines should be established for newborns follow-up and early management. Thank you.